Hey there, guys. Today I'm going to be talking to you about treatments for OCD. OCD, or obsessive compulsive disorder, can really run your life. If you have it, it can control every aspect of your day. You may constantly check the doorknob when leaving your house just to make sure it's locked. And of course, that's after checking it 5 or 6 times already. It's also not the easiest disorder to describe to someone. OCD affects everyone differently, and I'm just going to give you a couple of scenarios here. But ultimately, I think it comes down to worry. When you worry about whether or not your alarm clock is set, you worry about whether or not you left the stove on, you worry about the slightest germ or minuscule piece of dirt on anything you own. You worry about, this just impending doom, I guess. And sooner or later, all this worry builds up and it leaves you feeling helpless and victimized by your own obsession with perfection. And OCD has innocent victims as well. I mean, your coworkers, family, loved ones, they all suffer from your problem. They're all affected by your quirks. And it could be as simple as making them late for meetings, dinners, outings, or special events with time-consuming compulsions, to quadruple check things around you. You also may avoid physical contact with those you love out of your own discomfort towards germs or uncleanliness. And it's possible you're even losing touch with friends and family around you due to your fear of driving, which also affects many OCD sufferers. And perhaps your work is suffering, due to your inability to stay focused on anything other than your own compulsions. Now, these are just a few random scenarios that OCD can create. Whatever degree of OCD you suffer from, you need help, and the fact is the only one who can save you is yourself. Of course, the good news is you're not alone. Obsessive compulsive disorder, or OCD, affects 2.2 million Americans, or 1% of the US population, from ages 18 and older. And that's a pretty big piece of the pie. To get a better idea of the definition of OCD, um, obsessive compulsive disorder, or OCD, is characterized by unwanted, recurring, disturbing, and uncontrollable thoughts called obsessions and/or repetitive or habitual behaviors called compulsions. And among the most common obsessions are fear of being contaminated with germs, sexual or violent images, excessive orderliness, excessive attention to superstitions. On the other hand, symptoms might be milder, like, repeatedly washing your hands, obsessively worrying if doors are left unlocked, counting and silent repetition of words. The variations are really limitless. If you have any of the above signs or symptoms, it's really necessary to take action now. And you may think that these innocent habits aren't such a big deal, but their long-term effect becomes degenerative. And that's because once you think it's okay to obey one particular superstition, your mind will create all sorts of new rules to follow. So make the responsible decision to nip this problem in the bud right now. And the fact of the matter is, there is no cure for OCD. It's not like you get a shot in the arm from some doctor and your obsessive habits just cease to exist. It doesn't work like that. A habit is both broken and created within 90 days. And some people will argue that you can create and break a habit every 3 weeks, but honestly, I've seen this theory in action, and I think 90 days is a pretty good rule. In order to break your OCD habits, you've got to engage in normal, quote unquote, behavior and responses for 90 days. And that kind of habitual training conditions you for a permanent solution. You don't have to go through some rite of passage, though. You'll need to expose yourself to triggers of your compulsions in order to overcome the relentless urges to engage in the compulsive OCD behavior. And this particular strategy is known as cognitive behavioral therapy. And I'm going to talk about that in a minute. It's not a guaranteed fix. I mean, effective treatment of OCD anxiety may or may not widely reduce the repetition of your obsessions and compulsions. You, and only you, decide whether or not this works. There's no one to blame but yourself, so you really have to put in a lot of effort to overcome these habits. And I'm just going to talk to you about a few conventional OCD therapies here. Among the known procedures that help in OCD anxiety relief are behavioral therapy, also called psychotherapy, uh, pharmacotherapy, which is the use of medicine, general support, which is therapy and counseling, and of course there's anxiety reducing strategies. So first I want to talk to you about psychotherapy. And the first line of defense in OCD anxiety relief is psychotherapy or behavioral therapy. And with the assistance of your physician, you're going to undergo an exposure treatment and response prevention. The doctor is going to expose you to the source of your obsession and or compulsion, and you must prevent yourself from engaging the repetitive thoughts, ritual, or habit you usually do under normal circumstances. And this method, as an OCD anxiety relief, it's in fact been found to be effective by up to 75% of patients, and it's called cognitive behavioral therapy. So it works very, very well. I highly recommend you give this a shot. Next is pharmacotherapy. It's the use of medication, and that's usually the second line of defense. Medication prescribed for patients with OCD. Among these medications are selective serotonin reuptake inhibitors, such as Celexa, Luvox, Paxil, Prozac, Zoloft. Another group of medicines which was declared by one university as more effective is called clomipramine. Sorry, I have a little trouble pronouncing these medicines. But at the speed that medications are being distributed, by the time this video reaches you, I'm sure there will be just a new array of different medicinal names and that are synonymous with OCD relief. So contact your doctor if traditional CBT or cognitive behavioral therapy isn't working for you. Medication should be the next line of defense. And I highly recommend, no matter what, that you have some sort of support structure. For you to have effective OCD anxiety relief, seeking support is a must. Your family or friends, they're all instrumental to the success of your treatment, so it's best if you make them part of your recovery. And families and relatives, in most cases, they don't understand the plight of patients with OCD anxiety when they're forced to deal with the patient's obsessions and compulsions. So to minimize this, it's best if they come with you during your consultation with your doctor so that the condition may be explained to them and they have a better understanding of what's going on. And if you don't have family to turn to, you can always engage in the support of self-help groups, talk to a trusted friend, or seek spiritual advice from, a church, minister, rabbi, or religious figure in your life. And of course, I always recommend engaging in anxiety reducing strategies. And you can start your road to improvement right now. You can tackle your anxiety using natural strategies that work. I've posted 21 of the most effective anxiety stopping treatments in a video on my website called Anxiety Free Tactics. And the video takes you step by step through resolving panic attacks, general anxiety, depression, social phobias, and a whole host of other disorders, all using natural treatments consisting of mental and physical exercises. Now, it's not the kind of thing where you just watch the video and you lose your OCD immediately. It's not like that. You do actually need to take action and go through these exercises that you'll learn at home. However, once you do that, you're going to really start feeling better in minutes. So take the first step towards overcoming your anxiety and OCD today. You can watch the video right now at www.stop-anxiety-panic-attack.com. Get relief today. Don't put it off. Every day you live with your OCD is a day spent trapped in a cage. So break free with tactics that work and start right now by learning to end this anxiety and feel better fast. That's it for today, guys. Take care. Bye-bye.